So next, as we continue on our steps, we're in step 4. So step 1 was heart rate. Step 2 was rhythm. Step 3 was identifying the P wave. Step 4 is going to be measuring the PR interval. The PR interval measures the time interval from the onset of atrial contraction to the onset of ventricular contraction, which there's going to be some variables that go into this, but a normal interval should be 0.12 to 0.20 seconds. We will again measure the PR interval from the start of the P wave to the end of the P wave, or the start of the QRS. And just as I mentioned earlier, this is a 0.16. So with your PR intervals, are the PR intervals greater than 0.20 seconds? Are they less than 0.12 seconds? And are the PR intervals constant across the ECG strip? We want to measure more than one at least. So in this one, what we're going to look at is the PR interval, and this one is a good example. So it starts right there. I've got 1, 2, 3, 4 boxes, and then I have the start of the Q wave. So my PR interval for this would be 0.16. Now again, we've already looked at the first steps. My first step, rate 1, 2, 3, 4, 5, 6, 7, 8 is 80. My rhythm is regular. My P wave is uniform, upright, consistent all the way across. Now my PRI is 0.16. So does it fall within the normal parameters? Yes, it does. Then lastly, we're going to measure the QRS complex. The QRS complex is going to be measured from the start of the Q wave to the J point. So in this one, we have 2.5 boxes, which gives me a 0.10 second QRS. So your Q wave will always be your first negative or downward deflection of the large complex. Your R wave is your first upward or positive deflection following the P wave, and then the S wave is the sharp negative or downward deflection that follows the R wave. So questions to ask. Are the QRS intervals greater than 0.12 seconds? And in this case, they would be considered a wide waveform. Are the QRSs narrow or less than 0.12 seconds? And again, we're okay with that more than we're okay with this, with it being wide. And are the QRS complexes similar in appearance across the EKG strip? And that's going to be important too. We want to make sure that there's a similarity between them. So, using the same rhythm strip, we've got a rate of 80. We've got a regularity of regular. We've got a P wave that's present, uniform, upright. We've got a PRI of around 0.16, and then our QRS, we're going to measure our QRS. So I'll measure this one from the start right there on that line, and it ends in the middle of this line. So that gives me 2.5 small boxes. So that's going to be 0.12 seconds. So my rate is 80. It's regular. P wave is present, upright, and uniform. My PR interval was 0.16 seconds, and my QRS is 0.10 seconds. So all of these follow the rules of a normal sinus rhythm. Stepping ahead a little bit, but a normal sinus rhythm has uniform P waves, has a rate of less than 100 but greater than 60. It is regular in occurrence. Its PRI is less than 0.20. but greater than 0.12 seconds, and his QRS is 0.12 seconds or less. So this would actually be a normal sinus rhythm. Now, really quickly, let's look at the ST segment because it's going to be important for you to identify this J point when you're measuring your QRS. So your J point is where the S wave and ends and the ST segment starts, which is the period of time before the T wave. So again, your J point should be right in there. And it's not always easy to see, but we want to make sure that we are looking for it. Now, the ST segment can be elevated or it could be depressed, and at that point we would identify the J point well above or well below the isoelectric line. Then your T wave, like I mentioned, is your most dynamic wave, and it's produced by ventricular repolarization or relaxation. It's commonly seen as the first upward or positive deflection following the QRS complex. U waves. So U waves are not something we're necessarily going to identify as a standard 5-step approach. Sometimes a U wave can show up, and it's usually going to be just a little lump in the isoelectric line between the T wave and the next P wave. Artifact is something that you should look for. And there's 4 causes of artifact. And basically what happens on artifact is that it's picking up something that's not the normal electrical conduction pathway. It's picking up something that's not even in the patient's heart. It can be caused by movement, loose or defective electrodes. So we always want to make sure that our electrodes are placed very firmly on the patient. Improper grounding, which is an older issue with older monitors, which was 60 cycle interference, so radio waves or light waves or something of that nature. And then finally, if we see artifact and we can't determine that the patient was moving or that the electrodes were loose, then we want to look at the EKG apparatus and we want to see, is it faulty? And this is an example of artifact. What I will notice with the artifact, though, is that the R to R's are all regular, and I have a P wave, even though it's not a pretty smooth upright. It is upright, but it's not real smooth. It's right there. So it's not irregular at all. It's just that I've got all this junk right here, and so what I want to do is just check my machine, check my patient, make sure that everybody's still, and then try to get another printout. So this ends the 5 steps of EKG interpretation and essentially ends this module. Again, as always, let me know if you have any questions or concerns.